Hello, everyone. My name is Jeffrey Andrion, and the title of my presentation is Embracing Vulnerability, the Art of Empathy. What comes to your mind when I show you this? And what if I told you that this is actually a case study? Throughout history and throughout our medical education, we know that there is the science and art of healing. When we think about the art of healing, we think about the role of the humanities in understanding the human experience. We also think about the role of the humanities in understanding art as a form of medical practice, art as medicine, and the arts for medical education. The latter point, using the arts for medical education, is the subject of my presentation. There are many benefits to using arts for medical education, including understanding how students transition to clinical placements or improving students' observation skills. And if the arts have already been used in the past to advance medical education, what then is so innovative about my teaching method? Using the arts to interpret patient case studies is my teaching innovation. I have leveraged on the humanities and asked the students to use the arts to interpret the different case studies that I provided them. The class of 2027 were divided into 10 groups with limited instructions provided, and this is really to highlight collaboration, creativity, teamwork, and to experience vulnerability and empathy. This work received support from the ATSU Library and Communication and Marketing departments. When the ATSU Library team organized the art show and curated the different artworks of the students, we were astonished by the artworks presented by the students, and the artworks were really telling. Consider, for instance, the diagram that I showed you a while ago. This was actually the case of Mr. Rolls, who suffered from Alzheimer's disease. But rather than depicting the life of Mr. Rolls as somebody who just sat on a wheelchair or lying on bed, the students thought that Mr. Rolls' life should be celebrated, given his many accomplishments. Or consider the life of Jerome, who suffers from cystic fibrosis, that rather than delving into the barriers as a result of his diagnosis, the students felt that Jerome should be celebrated as a superhero after accomplishing so many things in life and for overcoming many barriers at a young age. And there's also the case of Andrea, a 24-year-old ballet dancer who fractured her ankle. Going over through the different emotions, at the end of it all, Andrea was seen as someone who is happy and excited for the future that lies ahead of her. And as I was thinking about the different art projects that were presented by the students, some of the key reflections included allowing the students to take a deeper look on what patients may be experiencing using the humanities. This work also demonstrated more empathy towards their classmates who were struggling on what to do with a project, given that some of them may have limited experience on using the arts as a form of interpreting case studies. This project also allowed the students to embrace vulnerability and stepping out of their comfort zones and reminding them of their shared values and emotions with their patients. This project also closely aligns with ATSU's core professional values, particularly critical thinking and developing interpersonal skills. In terms of teaching implementation and future directions, it's really important that students are given time to prepare and to really think critically about the case studies that were given to them, and to emphasize the rationale for the little instructions or the limited instructions that were provided to them. It is also important to remember that this work is a collaboration between many stakeholders. At the end of the day, this work is about making learning more fun, interactive, collaborative, and innovative. And I would hope to implement using the arts in my other courses and also a future research opportunity. Thank you very much for your consideration and for listening to my presentation.